Are you looking to increase your mobility, decrease the pain in your hips or knees, and improve your quality of life? Well, then you may be a candidate for knee or hip replacement surgery. There are over 1 million of the replacement surgeries performed each year right here in the United States. Surgeries that can alleviate pain, reduce limitations, and get people back to everyday activities sooner than they ever thought could be possible. If you're considering treatment for your orthopedic needs, stay tuned as we discuss the life-changing treatment and surgery options at Catholic Health Services and the industry's latest technological advancements. It's all in today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone. Thanks so much for joining us. I'm Jane Hansen. The Joint Replacement Program at St. Charles Hospital offers nationally ranked outstanding patient care. Their program stays on the leading edge of total joint replacement procedures and is tailored to meet each individual's specific needs. Joining me today from St. Charles Hospital is orthopedic surgeon Dr. Nakul Kakari. Welcome and thank you so much for being here. It's
Thanks
a pleasure
for having
to have
me.
you. So are you seeing, we're talking specifically about hip replacements with you. Are you seeing more and more of them necessary these days?
Yes, we are. As the body ages, the hair color changes, we get cataracts, and guess what? The joint wears down.
So we need new hips.
And a lot of those baby boomers are needing more and more hips and knees.
Is that because we've been a lot more active, or is it because it's genetic, or what is it?
We call it multifactorial, which means there are many reasons. For most patients, there is a genetic predisposition, and that is the cause for arthritis in the overwhelming majority of patients.
How do you know when it's bad enough that you need to have your hip replaced?
That's a great question. We keep it easy in orthopedics. I follow the 3-strike rule. First and the most important strike is the patient telling me that the pain interferes with their activities of daily living. They cannot do what they want to do on a daily basis because of the pain. That's the first and the most important strike. Second strike is that the X-ray shows arthritis. And the third strike is on clinical examination, I know that the pain is coming from that joint. Only if these 3 strikes come together, we discuss joint replacement surgery.
Now, you do a rather unusual, and you're known for the kind of hip replacement you do that is called the anterior approach. What's different from the past?
So traditionally, the hip replacement was done through a posterior approach, which means the surgeon went from behind to access the hip joint, and that involved cutting a lot of muscles. Because of that, the rehabilitation was a lot longer. The patients had to follow something called as hip dislocation precautions, which means that the ball can pop out of the socket. And what that meant to the patient was that they had to use a high toilet seat after the surgery for about 6 to 8 weeks. They should not be crossing their legs after the surgery, again for the same amount of time. And they should be keeping their knees apart. So they should be sleeping with a pillow in between their knees to prevent the ball from popping out of the socket. Mm-hmm. There are other advantages too of an anterior hip replacement because absolutely no muscles are cut during the surgery at all. We go between the muscles and do the hip replacement. So the rehab is a lot faster. And literature has shown that patients get rid of their assistive devices like a walker and a cane much sooner than the traditional approach.
So you've got this little doodad here. This is actually what you put into somebody's body.
This is a real hip, yes. The hip is made of 2 components. One is the ball, which goes on the upper side of the hip. And this is something that goes inside the thigh bone. So we put in the cup, we put in the stem, and then we put it all together.
It's amazing. And people can regain all of their activities very quickly afterwards, which
Absolutely.
is amazing.
Hip replacement is one of the most satisfying surgeries in orthopedics.
Well, you know what? On that note, let's take a look at some video of a patient of yours and talking about the process and what the patient went through. So let's look at the video.
I'm Jeff Huvar. I had my hip replaced about a year ago, and I wanted a hospital on Long Island, and it was important to me to make sure the doctor knew the anterior approach because it's a much quicker recuperation period. So I found Dr. Kakari and ended up here. I was first looking for a doctor that knew the anterior procedure, and there's very few in Long Island that knows how to do it professionally. Before I found Dr. Kakari, I was talking to some doctors in the city, which is, inconvenient to get to, and I wanted to stay on Long Island. And then I found Dr. Kakari. I guess I found him, it was through the internet probably that I found it. And I'm glad I did, actually. Mainly it started being painful sometimes when I was walking, and I ended up limping. And you don't want to lean to one way because that'll mess your back up. So I figured it's about time I got the thing done. Everybody was very friendly, and they made it very comfortable to what could be a scary situation. Before you could have the surgery, you have to attend this class which explains the procedure. Well, they just explained the whole procedure. You would come here at a certain time, you go to pre-op, and they just walked you through it, so you weren't just walking in cold. And then when you finally came for the, for the operation, you're in the pre-op, and they explain again what the procedure is, and before you know it, the operation is over, and you're in your room. As far as the rehab was concerned, I was home in like the second day. I came in like a Monday morning at 7, and like by Tuesday evening I was on my way home. And interestingly enough, I was back to work like the next day because I work out of the house. So I commuted down the basement, and I was able to negotiate my stairs. I have a colonial, so I had to go upstairs to bed and downstairs to work. So that was immediately. As far as the rehab, even the rehab was, they were surprised how quickly I was recuperating and compared to other patients that had the posterior approach. After I was released from the hospital, Catholic Health Services came to the house 3 times a week for the first 2 weeks, and after that, I went to St. Charles Outpatient Rehabilitation Center, which was right in Huntington. I would say the operation was a total success. I mean, there's just no limitation what you can do. I was probably sometimes had to use a cane occasionally beforehand, and now, it doesn't enter my thought what I can do and what I can't do. Dr. Kakari knows how appreciative I am of his services, and what a expert he really is in this particular type of procedure. And also there's follow-up involved. There's a couple of follow-up visits, and he makes sure everything's okay, and he knows I'm very happy with the results. And I may have to see him again for the other hip one of these days.
So it's no wonder you like to do hip surgery so much. The patients are always satisfied.
Exactly. The experience after getting a hip replacement is a lot different than getting a knee replaced. I tell my patients, getting hip replacement, don't speak to somebody who has a knee replaced. After a knee replacement, I tell my patients, you're not going to be happy at a month. You see light at the end of the tunnel at 6 weeks, and then you're significantly better at 3 months. After hip replacement, the first time they put their foot on the floor, they realize the difference. They're walking the same day of surgery with a walker. Then they progress on to walking with a cane on the other side, then to no support at all. But they're significantly better within days.
My brother had both of his hips replaced, and he was told by his doctor that he would have to wait a significant period of time between the 2 surgeries. But you actually now, and his was done 3 or 4 years ago, but you now can actually do both hips at once.
Absolutely. Now, we have to be very careful of who is the right candidate to get both hips replaced. Surgically, it's very easy to do them both at the same time. What we worry about is the medical aspect of things. So if a patient has cardiac problems, if there are severe lung problems, then we prefer to do one hip at a time or one joint at a time, simply because we worry about how the heart and lung will react to getting both hips done. It's a lot of surgery for the patient.
Yeah, it sounds like it. At St. Charles, you've got a really fine reputation for your orthopedic work. How did it take some time to develop that reputation, and why do you think you guys get such a good rap out there?
It's important to choose a hospital where joint replacement surgeries are done in a large volume. Literature is clear. The larger the volume, better the outcomes. So as example, at St. Charles Hospital, we have a preoperative class in which I encourage the patients to go there so they learn of what is involved in their hospital stay. What is going to go on? What are they going to do when they go in? What is going to happen the day of surgery? And we do a lot of discharge planning even before the patient goes to the hospital. And most hips go home. So we evaluate if they have stairs. So they know in their mind that if they have stairs, they should be able to go up and down stairs before they go home, as an example.
Sure, just thinking about simple things that it could be a hassle
Absolutely.
afterwards, but if you prepare ahead of time, then it eliminates the potential for something not so good happening, a fall or
Absolutely.
something. That's great. Well, congratulations on and all the great stuff you
Thank
do.
you.
Stick around. You're going to come back at the end of the show.
Great,
Lovely to
thank you.
talk with you. And we're going to take a quick break, but we'll be back with more CHS Presents Lifestyles at the Heart of Health right after this. And welcome back to CHS Presents Lifestyles at the Heart of Health. When you think of hip replacement surgery, do you think about spending days in the hospital? Well, what if you were able to go home the same day? Today we're learning about the new technologies in joint replacement surgery, and I'm excited to welcome orthopedic surgeon Dr. William Long from St. Francis Hospital, who has recently performed the first ambulatory hip replacement surgery at the hospital, and he's here to tell us all about it. Welcome.
Great, thanks very much for having me.
It's really hard for me to imagine this because my mother had her hips replaced, both of them, when back in, I don't know, when the 1970s perhaps. And she was in the hospital for so long. To go home immediately, that's amazing.
Yeah, it's incredible. A lot of things sort of change. So when we first apply new technology, we're decidedly careful and somewhat restrictive about it. But actually, if you think about it, many of the restrictions we apply are responsible for a lot of the complications we then see. So what we've slowly and gradually done over the years is realize that we're doing something really good, and a lot of the things we're doing afterwards in terms of restrictions, not letting people move, not letting them eat and drink, not letting them get up out of bed, making them sleep with a pillow between their legs, those were all iatrogenic introductions. Those were all things that we introduced, but they didn't help anyone. So what we now call the outpatient total joint replacement is really a culmination of a move towards a confident intervention, minimally invasive, very limited blood loss. We give a simple medication we didn't have 5 years ago that cuts your blood loss by 70%.
Wow.
If you bleed less, you have much, much less pain, and you have much less, systemic complications. We give you some injections around the hip with local anesthetics. They last a few days. And so we're able to get people up. And they're up out of bed, all of our patients, be they the young 45-year-old or 50-year-old or 60-year-old who may want to go home the same day, or the 90-year-old, they're all out of bed in the recovery room, walking with supervised physical therapy. And that gets them going again. It gets them confident that they can move. And really, we just don't apply any of those inappropriate restrictions anymore.
So that's a process of learning, a process of give and take and figuring out we can do this as you just pointed out. But what you're saying is, so how long is the surgery?
45 minutes.
45-minute surgery. In the recovery room, the anesthesia's wearing off.
Right.
They're up walking, an hour and a half later?
Hour and a half, 2 hours sometimes. It's really remarkable. But the whole story really starts earlier than that. It starts in the office. And one of the things that's interesting is it takes a lot more of my time to get you home the same day than it does to leave you in hospital for 5 days, send you to a rehab facility for 2 weeks. So it takes a lot more of my time to educate you and to give you the confidence that you can get up and get going. And then it takes more work with respect to having anesthesiology and having the nursing team in the OR. These are the same people. So everything's very predictable in the OR. We're able to cut our OR times. Anesthesia, because I can do it in the same amount of time, can then provide a shorter spinal anesthetic. That shorter anesthetic allows people to have the numbing wear off very quickly, and they can get out of bed in the recovery room. Then you have to have a physical therapist there. Right, so it's a multifactorial, stepwise approach.
But you wouldn't have, I wouldn't have thought of that if I use something that takes the numbness away quicker, that then they're going to have the confidence and the feeling so they can actually try to walk. Right. It makes perfect sense, but it's still very remarkable to think about how far this technology has come.
It really has.
And then, so what do you envision, going forward? Because you're doing this kind of surgery that's very effective very quickly. What do you see? What do you see for hip replacements down the road?
So what I see happening is really two streams, and that'll be the people, and I don't want to focus just on outpatient. I don't want anyone to think if they have to stay overnight, they're not a candidate for having the hip replacement done in a less invasive fashion. Everyone benefits. The 97-year-old I looked after last year with his hip replacement, he benefits tremendously, maybe more so than the young person, because it's so much less invasive. So what I see happening is us moving towards more of a patient-focused approach, and really it's a team effort. I don't want to sit here and have anyone think that I do this on my own.
Right.
This is a huge team around me. The anesthesia department at St. Francis under Steve Schulman has been remarkably helpful. Tanya, who looks after all of our postoperative care, has really, really been at the forefront of developing these techniques and tools. So I see us moving to where most people are in hospital either for a same day, 1 day, perhaps 2 days, but not only that, getting back into the workforce in under 2 weeks. So it has a tremendous economic benefit.
And not to mention being able to resume their other activities. How long before they can do sports? Golfing, tennis, things like that?
We've got beautiful shots, not of these, but of 2 knees being done at the same time. I do more bilateral joint replacements than I think just about anyone else in the country. I'm a strong believer in it. And we have people back on the tennis courts in 6 weeks. We have people back at work after bilateral hip replacements in 2 weeks. So we're providing the intervention, but we're not keeping you down. We're letting you get back, and it has not only short-term benefits, it has long-term benefits in terms of your recovery and your return to activity.
Well, I just think that's fabulous. What an amazing process this has been, and it's only going to get better.
I think it will.
Thanks so much for being with us. We have to take another break, but don't go anywhere because there is much more of CHS Presents Lifestyles at the Heart of Health. We'll be right back. Welcome back to CHS Presents Lifestyles at the Heart of Health. With the addition of board-certified and fellowship-trained orthopedic surgeons, the orthopedic department at St. Joseph Hospital has enjoyed significant growth. Joining us now to discuss all about the growing success there as an entity of Catholic Health Services is one of the hospital's orthopedic surgeons, Dr. Fernando Checo. Welcome. It's good to have you here.
Thank you for having me.
So we're going to talk about spines. And you've got a new minimally invasive surgery that's really making a huge difference for patients.
So the concept is patients who have pathologies in the lumbar spine, scoliosis, slippage, which is called spondylolisthesis, or who have instability. The traditional route of having surgery in those situations was an open approach where you would make a big incision, expose the spine and instrument it, decompress it, and then close up. The problem with that is that it takes a lot of time to dissect. It takes a lot of muscle stripping, and you can potentially lose a lot of blood. And post-operatively, it can cause a significant amount of pain.
Sure.
So for that reason, minimally invasive surgery was created.
Okay, so I know you've got some, you're going to take us through this real quickly. So Talk to me about exactly how this works.
Well, you have to be a candidate for it. You have to you have to be a candidate for a fusion, and discussion you have with the patient regarding open versus closed and the benefits of open, closed versus open. As you can see on the screen, with magnification and illumination with the microscope, you can utilize that magnification to make smaller incisions, which can lead to less soft tissue disruption, which in multiple recent articles have shown to decrease blood loss, hospital stay, and even the requirement for narcotics or pain medications.
Wow.
So
those are the differences, huh?
yes, this is actually the same levels. On the left is an open surgery performed, and for a two-level interbody fusion, where you put screws from level number 4 to sacrum number 1, and you put 2 cages by replacing the disc. And on the right is a minimally invasive, where you put screws in percutaneously, and you put the cage from the right side. As you can see, the midline is not exposed, so the soft tissue envelope is still attached. So on the patient on the right,
It's much prettier too, I have to say.
also less painful.
Yes. And then you've also got, now continue on with, okay.
So this is just a picture from the operating room where you use the microscope. The ability to magnify the anatomy allows you to find movements to be able to do the surgery, which has led to, again, less soft tissue injury, less blood loss, and less hospitalizations, length of stay.
Okay.
This is just a schematics showing the system. It's a tubular retractor. You basically dock where you have to operate, and through that tube, you perform your surgery. And then this is another one. This is a fusion where you can see that you dock,
Yeah.
you get access through that tube. You're able to use the microscope to magnify the anatomy, and then you use fluoroscopy to instrument the spine, and then decompress the spine and eventually close up.
And so then what happens is that you really have given the patient a much better way of going through this process and feeling much better, much more quickly.
Well, I think now with outcome measures, patient-derived outcome measures, the length of stay is going to become important, the level of pain, the level of pain medication required, and the length of pain. And the ability to get the patient up and walking soon is very, very crucial.
Yeah, I'm sure it is. Now, when you say, what about recovery time? How long does it take?
I've had patients leave the same day. And on average, the hospital stays two days, basically, for a single-level fusion.
As opposed to what would it have been in the past?
Anywhere from 4 days to up to a week.
That's a huge difference. And again, the people who are eligible for doing this?
Well, really, anyone who is eligible for a fusion, you can technically do it minimally invasive. It's really a matter of surgeon experience, comfort level that dictate it.
Well, in these last couple of minutes that we have, I'm going to invite our other doctors to come back, Dr. Kakari and Dr. Long. And if you'll come back in, I just want to have some final words to people who might be considering any kind of these surgeries, the joint replacement, the orthopedics, and why they should do it at Catholic Health Services.
So today I would say we have excellent options to treat hip and knee pain. We want patients to be active. We want them to be pain-free. So if patients have pain in their joints, it's time to speak to an orthopedic surgeon.
And what's the most rewarding thing they say to you when it's all over, when they're going home the same day after they've had hip surgery?
You know, I always tell them not to thank us until they're back to the level of activity they're looking for. But everyone's sitting and standing with me here today does something that they love, and it's extraordinary the thanks you get every day. There's no wonder that surgeons in days past sort of had a large ego, also nicely.
But you don't anymore, right?
We're not allowed to anymore. But no, really, it's a very,
Absolutely.
very
If I
rewarding.
were to get a $1 billion lottery, I would still continue to do what I do, simply for that reason.
Well, thank you all for being part of Catholic Health Services and for sharing your stories here with us today.
Thank you.
Thanks.
Thank you.
And of course, for more information or to schedule an appointment with Catholic Health Services, just call 855-CHS-4500 or visit chsli.org. Thank you for joining us today. I'm Jane Hansen, wishing you goodbye and good health. Bye.